Hi, Cassie. How are you?
Hi, good. How are you?
Good. My name's Megan. I'm going to be your OTA today. Have you ever worked with OT before?
No.
No? Are you familiar with what it is?
I think so, kind of.
All right. So, as an occupational therapist, we look at your day-to-day activities. We see what you're having a little bit of trouble with, and then as OTs, we provide techniques, equipment, and advice to help you gain your independence back.
Oh, cool.
So, one of the things that you had expressed was dressing.
Mhm.
You're having a little bit of problem after your stroke with some dressing, and your left side of your body is unable to move. So I'm going to give you a couple of techniques to use to help dress yourself. And I do love this shirt that you picked out today.
It's my favorite.
Awesome. All right, so the first thing that we're going to do is I'm going to show you and demonstrate how to do it properly, and then we're going to go through it and I'm going to talk you through it. The first thing that you want to do is make sure that your arm is rested nice on your leg. We're going to use our non-dominant hand, or the one that is going to be dressing us today, and we're going to grab the collar of the shirt by the middle. Is this the shirt that you want to wear today?
I guess so.
No, it's not as flashy as that one, but it'll do today. It's going to be a little bit easier because it doesn't have any buttons on it.
Okay.
So we're going to learn this. We're going to place the sweater on our lap with the tag facing up. Once we're here, we're going to open up the bottom of the sweater. We're going to make some room for our hand to go in. We're going to assist our hand into the sweater, and we're going to use our non-dominant hand to pull our hand through the sweater. Now there are two different ways we can do this. We can either pull this all the way up to our shoulders, or we can reach inside here and grab our hand and pull through. But I'm going to show you this first one. So I'm going to grab the bulk of the sweater and I'm going to pull my sweater up until I see my hand at the bottom. I'm going to pull my sweater all the way up to my shoulder to make it easier when I pull it over my head. And next I'm going to put my non-dominant hand, or my dominant hand, into the sweater sleeve. You always want to start with the hand that is having some trouble first, and we're going to put our dominant hand in second. The next step is we're going to crumple up the collar. We're going to tuck our head slightly and pull it over. And then after it's all over our bodies, we're going to be able to adjust it. And then our sweater is on for the day. You can look.
Looks nice on you.
Thanks.
You're welcome.
The next part we're going to do is grab the back collar if you want to take it off. So we're going to find that tag again, and we're going to slip it right over our heads and pull out our arm, our strong arm, and then we're going to use the tip of the sleeve to pull out the rest of our arm while keeping our arm rested on our legs so that we don't have any slumping of the shoulder. So we don't want to injure our shoulder joint. You ready to try? Awesome. Let me fix this for you. Well, let's grab our sweater right over here. And now we're going to place the tag down on the top hand side. Perfect. Yep, so the front of the collar is going to be facing the ground and the tag is on the way up.
Mm-hmm.
So let's open up the bottom of the sweater. I know it's going to be a little challenging, but we're going to work on it today. So we're going to start with our weak hand first. So we're going to use our non-dominant hand and we're going to place our arm into the hole that we created. Perfect. Now there's two ways to do this. We can either use our non-dominant hand to pull the sweater onto our sleeve, or you can reach through the sleeve and pull out your arm. But I think we're going to start with the first one. So let's pull the sweater up and place your hand into the sleeve. And keep pulling till it's all the way to your hands, all the way up. Awesome. Now let's lift this up to the top of your shoulder, as high as you can go. Awesome, that's good right there. And now we can put our strong hand into the other sleeve. And don't pull it up just yet. Great. So now, once you have this arm in, we're going to use our strong hand to crumple up the rest of the sweater until you see the head hole. Tuck your head slightly and pull it over your head. Awesome. And then you can adjust yourself. I know it's going to feel a little odd at first, but it's going to take a little extra movement.
It looks beautiful.
It does look really good. Does that feel okay?
Yeah.
That's a nice sweater. It's comfy.
Oh, I love it.
Awesome. Now the same way, we're going to pull it off. So you're going to reach back behind the collar of your back shirt and pull it right over your head. Awesome. And now you can pull out your strong hand. Great job. And then you can pull it off your other hand. Now when it comes to working with a patient who has a left side paresis, you want to make sure that before beginning the activity, there's no subluxation of the shoulder. Also, when doing dressing techniques for anyone who has had any left hemiparesis or doesn't have movement of this arm, looser clothing is often easier to manipulate and it's more comfortable for the patients and it requires less endurance while putting it on.